Chesterfield Fire and EMS is an all-hazards emergency response agency. Chesterfield County Fire and EMS protects a population of 320,000 citizens in a 446 square mile county in the Richmond metro region of Virginia. Over 700 professionals respond to over 36,000 calls per year.
There are very few agencies across the country that have a full-time operational medical director. An agency who has a full-time operational medical director really can develop their programs such as process improvement, protocol development, quality assurance, and research. Post-resuscitation hypothermia guideline is an entire strategy on how to deal with patients during a cardiac arrest. We give ice-cold saline intra-arrest and continue it throughout the cardiac arrest management. The ice-cold saline slows the activity of the brain and gives it a chance to heal. One of the worst things to do is allow a brain after a cardiac arrest where they lack perfusion is all of a sudden resend a lot of blood back to those cells, because the actual blood coming back to the cells destroys it. It kills the brain cell. If we get a pulse back, we continue the ice-cold fluids and then take these patients to very, very select regional centers.
One of the most important aspects of this protocol of cooling the body down is that it be done quickly. Many times it happens in the pre-hospital setting before the patient ever comes to the hospital. We found that in Chesterfield County in particular, they have close transport times to our hospital, they have very short response times to their patients, and so they're intervening and making a difference early on.
On March 1st, 2012, my husband had found me in bed. I had passed away with cardiac arrest. He immediately called 911. About 5:50, the call went out and the ambulance came to my house at 5:55. They immediately shocked me. They started IVs and put me on code ice. Rescue squad was there within 5 minutes. They saved my life. They were amazing.
In the Richmond metro region, we place a lot of importance on regional collaboration. We not only interact with emergency services organizations, fire and EMS organizations, but we also have some very effective partnerships with our law enforcement agencies. Our tactical medics are embedded with the SWAT team officers from the Chesterfield County Police Department. For over 25 years, we've partnered with the Virginia State Police on the Med Flight program. And that involves a police helicopter and a police pilot that's partnered with a two-person flight medic crew that staffs an air ambulance service here in the region. We've worked to develop various policies and procedures on how to handle specific emergencies such as high-rise incidents, big box incidents, as well as Mayday firefighter down scenarios. Everybody is working from the same game plan.
We work with Chesterfield County in structural and hazmat responses, and we work so closely with them that it's really invisible between the two units. When we respond on scene, we understand their command structure, we understand their incident. Working with Chesterfield makes the community safer in the fact that we are able to provide more resources to the incident in a timely manner.
One area that we focus a lot of attention on is the training and development of our members. In today's world, it's often difficult to take advantage of experiential learning, so we spend a lot of time focused on computer simulations and trying to create real-world scenarios at our training center, our burn buildings, and other training props that we have.
One of the unique things about Chesterfield Fire and EMS is we offer and provide an applied leadership program where they manage a fictitious shift for an 80-hour program, which allows them to problem solve and deal with problems prior to having to deal with them in the field for the first time. We use command sim technology that allows us to simulate fires in various structures or settings, and it is an interactive program in which we can change the variables. This program allows us to deliver the training to the various fire stations throughout the county. The county is very large geographically. This reduces the companies from having to come to the training center, allowing them to maintain being in service in the field and providing service to the customer.
This is the best job in the world, and we certainly are very proud of the services that we provide here in Chesterfield. My vision for the future is to continue to be a world-class fire and EMS organization. We have to look for unique partnerships. We have to look at leveraging the resources that we do have, working smarter, using technology more, and continuing to train and develop our members to excel into the future.